Hello, everyone, and welcome back to Youthful Medicine. I am Dr. Tahir, a board certified rheumatologist and an obesity medicine specialist. As a rheumatologist, I take care of patients who have autoimmune disease, and you may have heard about lupus. And of course, those patients who have chronic autoimmune diseases, they are also concerned about their weight management, and weight gain could be a problem, especially if they've been prescribed medications like prednisone, because not only autoimmune disease patients are unable to move as readily as because of their arthritis, they also get prescribed medications which could be a problem with increasing their weight. And prednisone is a common example. So, in this video today, I would be talking about a question that was asked to me by a patient, which was, is semaglutide safe to be used for a patient who have systemic lupus? And this is a very good question, and I thought I should discuss it with you all. So, if you're new to this channel, I would like you to welcome you and let you know that I talk about autoimmune diseases and its correlation with autoimmunity, inflammation, and obesity. And I also would talk to you about the integrative treatment options because that is also one of my other board certification. So the question today is semaglutide safe for autoimmune disease patients? How to address weight loss in autoimmune disease patients? Well, as we all know, that semaglutide is the compound used in the brand name medication called Wegovy or Ozempic. Wegovy is their name for the weight loss treatment, whereas Ozempic is used for their patient population who are going to be prescribed who are diabetic. But both the medications are exactly same compound, which is semaglutide. Their names are just different for different group of population of patients. Now, how does Wegovy work? So Wegovy is a glucagon-like peptide analog. It works to improve the glucose metabolism in the body. And there are hundreds and hundreds of videos about this topic, so I'm not going to go into details about it. But how this works is it decreases the appetite as well through the central pathways. It decreases gut motility, so we are not hungry all the time. It improves the outcomes of glucose utilization in the body. And all in all, it leads to decreases insulin resistance, improves glucose metabolism, and helps us lose weight. These medications so far have been quite safe in our clinical practice, and I believe they will continue to be a great addition to our patients' wellness and weight loss journey. So, the question we have to ask is, what should we do if a patient who has an autoimmune disease is questioning or want to have weight loss treatment? Well, most of all, if you have an autoimmune disease patient, please understand that autoimmune diseases are complex and they can have variation in their severity even during the course of a year. So making sure that you're seeing a rheumatologist who understands these diseases and can tell you that you are in remission before you start weight loss journey. Number two is, if you are currently using medications that may interact or decrease your glucose levels, like if you're on metformin or something, talk to your primary care doctors about discussing about the utilization of Wegovy on top of your current medications. It should not be a problem, but making sure that it's customized to your personal medical history. So, when somebody has an autoimmune disease like lupus, there are disease activity markers or biomarkers that are checked for making sure the patients don't have any active autoimmune disease. So, we are looking at their serologies, anti-nuclear antibodies, we're looking at C-reactive protein, we're looking at complements level, we're looking at SED rate, and also making sure that they're hemodynamically stable, their blood counts are normal, the liver kidney functions are normal. So autoimmune diseases can affect other organ systems. So you need to make sure that liver, kidneys, and every other system of the body is functioning well before adding another medication. The good news is semaglutide and its safety in autoimmune diseases is unquestionable. I do not have any, I've not come across any literature stating that there is any use related cases where semaglutide or for a matter of fact tirzepatide has triggered any patient with an autoimmune disease. So there is no specific contraindications to use semaglutide or weight loss treatment in autoimmune disease patients. However, we always take a personalized approach with these patients, so it is important to understand that semaglutide modulates the metabolism and appetite, but it does not suppress the immune system. So again, it does not suppress the immune system. It suppresses your metabolism, modulates your metabolism, and decreases your insulin resistance. And it helps you lose weight. So, in this patient who I spoke to about her lupus, we decided that we will proceed with semaglutide as her weight loss treatment because her lupus has been pretty active. But over the course of years, because of her joint pain, she was not able to lose weight and be active. And this would be a great addition to her. Obviously, I'll be monitoring her very closely and help adjust her dose of semaglutide and also her lupus medications. So, all in all, I would say stay up to date about the new indications of the medications. Make sure that you are staying in touch with your doctors to get the help you need. And so far, the good news is that GLP receptor agonists like semaglutide do not negatively impact the immune system. However, if there is any suspicion of you having a flare, your rheumatologist will be able to give you treatment options while you are on Wegovy. And if you are in a major flare, maybe holding the medication and adjusting to address your immune attack of lupus would be more wiser approach. So if you like this video, please make sure to like it, share it with someone who may also benefit with it. And I will say that being your own personal advocate in taking care of your health is the key. And that's why we make these videos and share our thoughts with our listeners so that they can be more active in their healthcare decision making. And take care of yourselves, and I'll see you in the next video.